Hi again, everybody. With many countries experiencing a second wave of coronavirus, why are some places hit worse than others? Well, Dr. Johnny Pearson-Stuttard is an epidemiologist at Imperial College London and a trustee of the Royal Society of Public Health and has examined excess death rates in different countries. He joins us now. Hello to you, Doctor. Thanks for joining us on the programme. Tell us a little bit more, if you would please, about your study and what the headlines were for you.
Yes, thank you very much. So we looked at 21 countries across the high-income and industrialised world and looked from the middle of February through to the end of May. And then we looked at how many deaths occurred in those 21 countries above what we would have expected had there not been a pandemic. And so what we found was across the 21 countries, there was 206,000 excess deaths, and that's about a 23% increase in the number of deaths over that period. But as you would imagine, that wasn't equal across the countries. So in some countries, such as New Zealand and some of the Nordic countries, there were very few, if any, increase in death at all. Whereas in countries like England and Wales, Spain, Scotland, Italy and Belgium, there was more than a 30% increase, with Spain at 38% and England and Wales at 37%, having the highest increases in death over this period.
And were those excess deaths all as a result of coronavirus?
That's a really important point in question. So over this period, what we looked at was excess deaths from all causes. And as both the Chief Medical Officer and the Prime Minister have said, that is the measure that we're most important and most interested in to see the total mortality impact of the pandemic. So what we found was around about 80% of all of those deaths were attributed to COVID-19, but there was still a large number that weren't. And there's several reasons for those. Some of them might have been COVID, but either because they didn't have a positive test, they weren't labelled as such, or they were misdiagnosed. But it's certainly true that others will have been due to other conditions, whether that was increasing in death rates in dementia or other chronic conditions. But this points to why, as we look to the second wave, tracking this all-cause excess deaths is so important, because we know back in the first wave, our health system, as with many others, pivoted to focus almost exclusively on COVID-19. And unfortunately, that has had an effect on, for example, cancer referral rates and other chronic diseases. So it's really important that we track those excess deaths across all causes over the next 6 months.
And are they deaths just in hospital, or are they all deaths that have been registered?
So again, that's really important. What we do here is capture all deaths, community or hospital, over that period, and across all of the countries using 10 years of their data to be able to model what we might have seen. But as you might imagine, all of this variation, it's very difficult to tease out why some countries did much better than others. And what's definitely true is it isn't just one thing. So we grouped these potential causes of the variation, why England, Wales, Spain, Italy did much worse than some other countries, to 3. So the first, for example, was the health of the public at the start of the pandemic. So, for example, were obesity rates high, the diabetes rates high, and also do we have an elderly population that are densely populated in cities? The second was on the state of the health, social care and public health service. So, for example, what was the resilience like with ITU beds and ventilators? Did we have a functioning test and trace system? And then the third and important area is the policy response itself. So what we found was those countries that had really good test and trace systems already embedded that could continue throughout the first wave did much better. And that those that didn't have that, if they implemented a lockdown earlier in the pandemic when their cases were relatively small, again, they did much better. And that provides real important lessons for this second wave.